Welcome nurses and future nurses. If you've ever sat down for an Nclex practice exam and thought, how do I know which patient to see first? Then this video is exactly for you. Today, we're diving into 50 high-yield priority Nclex questions that test one of the trickiest but most important skills, deciding who gets your attention first. We'll break down each scenario step by step, using ABCs, Maslow's hierarchy, and test-taking strategies to make sure you'll never second-guess yourself on exam day. Stick with me until the very end. I promise, by the time we finish, you'll feel way more confident in tackling any priority question the Nclex throws your way. Let's get started. Question 1. A client with pneumonia reports shortness of breath and has an oxygen saturation of 86% on room air. A. Reassure the client. B. Place the client in high Fowler's position. C. Start IV antibiotics. D. Obtain a sputum culture. Answer: B. Place the client in high Fowler's position. Rationale: positioning immediately improves oxygenation. Strategy: airway first. Question 2. You're the charge nurse. Which patient do you assess first? A. Client with chest pain radiating to left arm. B. Client with COPD needing assistance walking to the bathroom. C. Client awaiting discharge teaching on insulin administration. D. Client with chronic leg ulcer asking about wound care. Answer: A. Client with chest pain radiating to left arm. Rationale: possible MI equals life-threatening. Strategy: acute greater than chronic. Question 3. A client with type 1 diabetes is confused, sweaty, and trembling. What should the nurse do first? A. Recheck the blood glucose. B. Notify the healthcare provider. C. Give 4 ounces orange juice. D. Document findings. Answer: C. Give 4 ounces orange juice. Rationale: obvious hypoglycemia. Treat immediately. Strategy: don't delay urgent interventions. Question 4. The nurse is caring for 4 patients. Who should the nurse see first? A. A patient with asthma using accessory muscles to breathe. B. A patient with Alzheimer's who was wandering in the hallway. C. A patient scheduled for surgery asking about NPO status. D. A patient with diabetes requesting a snack. Answer: A. Asthma with accessory muscle use. Rationale: respiratory distress equals emergency. Strategy: ABCs always. Question 5. The nurse receives report. Which client is priority? A. Client with a potassium level of 6.8 milliequivalents per liter. B. Client with hemoglobin of 9 grams per deciliter. C. Client with blood glucose of 180 milligrams per deciliter. D. Client with a urinary tract infection. Answer: A. Potassium 6.8 milliequivalents per liter. Rationale: hyperkalemia equals risk of cardiac arrest. Strategy: critical labs equals priority. Question 6. The nurse has 4 clients. Who should be assessed first? A. A client with a fractured femur in pain rated 9 out of 10. B. Client with COPD with oxygen saturation of 82%. C. Client with pneumonia awaiting IV antibiotics. D. Client with diabetes needing morning insulin. Answer: B. COPD patient with O2 sat 82%. Rationale: severe hypoxemia threatens life. Strategy: airway or O2 greater than pain. Question 7. The nurse should see the client first. A. Client with chest tube drainage of 100 milliliters per hour. B. Client with tracheostomy coughing up thick secretions. C. Client 1 day post-op with a fever of 100.8 degrees Fahrenheit. D. Client with the stage 3 pressure ulcer asking for pain medicine. Answer: B. Tracheostomy with thick secretions. Rationale: airway obstruction is immediate threat. Strategy: airway, possible infection, pain. Question 8. The nurse is caring for 4 clients. Who is priority? A. A client with an IV infiltration. B. A client with a nosebleed. C. A client with a blood transfusion who reports itching. D. A client with arthritis requesting pain relief. Answer: B. Client with DKA, blood glucose 560 milligrams per deciliter. Rationale: severe metabolic emergency can be fatal. Strategy: physiological greater than psychosocial. Question 9. The nurse has the following clients. Who should be seen first? A. Client 3 days post-op reporting pain 6 out of 10. B. Client with COPD reporting worsening shortness of breath. C. Client with hypertension waiting for morning meds. D. Client with diabetes requesting blood sugar check. Answer: B. COPD patient with worsening SOB. Rationale: respiratory distress is priority. Strategy: ABCs greater than pain greater than routine meds. Question 10. The nurse enters the room of 4 patients. Who is the priority? A. A client with an IV infiltration. B. A client with a nosebleed. C. A client with a blood transfusion who reports itching. D. A client with arthritis requesting pain relief. Answer: C. Blood transfusion with itching. Rationale: possible anaphylactic reaction. Strategy: look for anaphylaxis or bleeding first.
Question 11. Which patient requires immediate attention? A. Post-op hip replacement with mild pain. B. Client with new onset confusion after stroke. C. Client with CHF with 2+ leg edema. D. Client awaiting discharge instructions. Answer: B. New onset confusion after stroke. Rationale: could indicate worsening cerebral perfusion. Strategy: change in LOC equals priority. Question 12. You are caring for 4 patients. Who do you see first? A. Client with asthma who is wheezing. B. Client with anemia with hemoglobin 8.5. C. Client with diarrhea for 2 days. D. Client post-op appendectomy requesting pain meds. Answer: A. Asthma with wheezing. Rationale: wheezing equals narrowed airway. Strategy: ABC's rule. Question 13. The nurse is assessing patients. Who should be seen first? A. Client with suspected DVT complaining of calf pain. B. Client 2 days post-op coughing up pink frothy sputum. C. Client with hypertension needing morning BP check. D. Client with gastritis asking for antacid. Answer: B. Client coughing up pink frothy sputum. Rationale: indicates pulmonary edema life-threatening. Strategy: emergent over routine. Question 14. Which client is priority? A. Client with pneumonia reporting fever of 101 degrees Fahrenheit. B. Client with TB in negative pressure room. C. Client with COPD, RR8 per minute after receiving morphine. D. Client with anemia HCT 30%. Answer: C. COPD with RR8. Rationale: respiratory depression equals life-threatening. Strategy: ABC's infection control. Question 15. Who should the nurse see first? A. Client with renal failure awaiting dialysis. B. Client with chest pain unrelieved by nitroglycerin. C. Client with stage 2 pressure ulcer. D. Client with diabetes requesting insulin education. Answer: B. Chest pain unrelieved by nitro. Rationale: indicates ongoing ischemia equals MI risk. Strategy: unstable angina chronic issues. Question 16. For clients arrive in the ER, who should be seen first? A. Client with severe abdominal pain, guarding. B. Client with SOB and stridor after bee sting. C. Client with fractured arm and a sling. D. Client with migraine headache. Answer: B. SOB and stridor after bee sting. Rationale: anaphylaxis airway compromise. Strategy: airway emergencies pain. Question 17. Which client do you see first? A. Client with new facial droop and slurred speech. B. Client with leg cast asking for pain meds. C. Client with mild dehydration requesting 4 fluids. D. Client with diabetes awaiting meal tray. Answer: A. New stroke symptoms. Rationale: time-sensitive intervention for stroke. Strategy: sudden neuro change equals priority. Question 18. Who is priority? A. Client with oxygen saturation 78% on room air. B. Client with potassium 5.5 milliequivalent/L. C. Client with hemoglobin 7G/DL. D. Client with blood glucose 350 mg per deciliter. Answer: A. O2 sat 78%. Rationale: hypoxemia is immediate threat. Strategy: airway circulation metabolic. Question 19. Which patient should be seen first? A. Client with post-op pain rated 7 out of 10. B. Client with chest trauma and tracheal deviation. C. Client with fever of 101 degrees Fahrenheit. D. Client with COPD requesting inhaler. Answer: B. Chest trauma with tracheal deviation. Rationale: tension pneumothorax equals life-threatening. Strategy: airway obstruction signs first. Question 20. The nurse has 4 clients. Who first? A. Client post-thyroidectomy with hoarseness and stridor. B. Client with leg ulcer requiring dressing change. C. Client with diabetes requesting snack. D. Client awaiting discharge with family. Answer: A. Post-thyroidectomy with stridor. Rationale: indicates airway obstruction. Strategy: surgical airway complications equals top priority. Question 21. Which client is the priority? A. Client with ESRD awaiting dialysis. B. Client post-op hip surgery with sudden shortness of breath. C. Client with constipation requesting stool softener. D. Client with migraine headache. Answer: B. Post-op hip surgery with sudden SOB. Rationale: high risk for pulmonary embolism. Strategy: sudden respiratory change chronic condition. Question 22. The nurse is caring for 4 patients. Who should be assessed first? A. Client with acute pancreatitis reporting severe abdominal pain. B. Client with appendicitis awaiting OR. C. Client with asthma and audible wheezing. D. Client with chronic hypertension awaiting meds. Answer: C. Asthma with wheezing. Rationale: indicates narrowed airway. Strategy: ABC's pain surgery. Question 23. Which client requires immediate intervention? A. Client with chest pain relieved by rest. B. Client with diabetic ketoacidosis, DKA. C. Client with chronic kidney disease and hemoglobin 9. D. Client with stable angina awaiting ECG. Answer: B. DKA. Rationale: life-threatening metabolic crisis. Strategy: acute unstable stable chronic. Question 24. Which client should the nurse assess first? A. Client post-op abdominal surgery with rigid, board-like abdomen. B. Client with gallstones scheduled for surgery. C. Client with asthma awaiting bronchodilator. D. Client with UTI awaiting antibiotics. Answer: A. Rigid, board-like abdomen. Rationale: indicates possible peritonitis/hemorrhage. Strategy: signs of shock/bleeding scheduled issues. Question 25. Who should the nurse see first? A. Client with a nosebleed not stopping after 15 minutes. B. Client with tracheostomy tube dislodged. C. Client with arthritis complaining of morning stiffness. D. Client with CHF reporting mild edema in legs. Answer: B. Tracheostomy tube dislodged. Rationale: immediate airway emergency. Strategy: airway loss equals top priority. Question 26. Which patient requires immediate assessment? A. Client with insulin reaction who is unconscious. B. Client with COPD on 2LO2. C. Client with anemia awaiting transfusion. D. Client with hip fracture awaiting X-ray. Answer: A. Insulin reaction, unconscious. Rationale: severe hypoglycemia causes brain injury. Strategy: unconscious plus hypoglycemia equals emergent. Question 27. Who is the priority patient? A. Client with chest pain radiating to jaw. B. Client with depression refusing to eat breakfast. C. Client with UTI reporting dysuria. D. Client with hypertension asking about meds. Answer: A. Chest pain radiating to jaw. Rationale: possible MI. Strategy: cardiac ischemia psychosocial. Question 28. Which client does the nurse see first? A. Client with stroke, new onset difficulty speaking. B. Client with pneumonia, productive cough. C. Client with diabetes awaiting insulin. D. Client with skin rash requesting cream. Answer: A. Stroke with new onset dysphagia. Rationale: indicates progression/worsening of stroke. Strategy: acute neuro change equals priority. Question 29. The nurse has 4 clients. Who is priority? A. Client with asthma, RR 36 per minute, O2 sat 84%. B. Client with COPD awaiting nebulizer treatment. C. Client with hypertension 170/95. D. Client with gallbladder pain 7/10. Answer: A. Asthma with RR 36 and O2 sat 84%. Rationale: severe hypoxemia. Strategy: airway/breathing always first. Question 30. Which client requires immediate care? A. Client with chest trauma, absent breath sounds on right side. B. Client with diabetes reporting thirst. C. Client with fever of 100.4 degrees Fahrenheit post-op. D. Client with sprained ankle needing ice. Answer: A. Chest trauma with absent breath sounds. Rationale: tension pneumothorax. Strategy: ABC's infection pain. Question 31. Which patient is priority? A. Client with CHF reporting orthopnea. B. Client with post-op incision drainage. C. Client with gout complaining of pain. D. Client with anemia reporting fatigue. Answer: A. CHF with orthopnea. Rationale: indicates fluid overload/respiratory compromise. Strategy: breathing difficulty equals urgent. Question 32. Who should the nurse see first? A. Client with hypertension, BP 180/100. B. Client with stroke, new confusion. C. Client with fractured tibia reporting 8/10 pain. D. Client with diabetes needing AM insulin. Answer: B. Stroke with new confusion. Rationale: indicates decreased cerebral perfusion. Strategy: LOC change equals top priority. Question 33. The nurse is caring for 4 patients. Who is the priority? A. Client with postoperative wound dehiscence. B. Client with asthma using accessory muscles to breathe. C. Client with nausea post-op. D. Client with anemia reporting weakness. Answer: B. Asthma with accessory muscles. Rationale. Airway compromise wound problems. Strategy, ABC surgical complications comfort. Question 34. Which client requires immediate attention? A. Client post-lobectomy with tracheal deviation. B. Client with diabetes requesting meal. C. Client with cellulitis awaiting antibiotics. D. Client with anemia hemoglobin 9. Answer, A. Tracheal deviation. Rationale, tension pneumothorax airway obstruction. Strategy, airway shift equals life-threatening. Question 35. Who should the nurse see first? A. Client with severe epistaxis. B. Client with CHF reporting weight gain of 5 pounds in 2 days. C. Client with pneumonia awaiting sputum culture. D. Client with arthritis needing pain meds. Answer, A. Severe epistaxis. Rationale, risk of airway obstruction and blood loss. Strategy, uncontrolled bleeding chronic issues. Question 36. Which client should the nurse assess first? A. Client with acute asthma attack and silent chest. B. Client with COPD using pursed lip breathing. C. Client with post-op pain 6/10. D. Client with diabetes awaiting insulin teaching. Answer, A. Asthma with silent chest. Rationale, indicates no airflow equals impending respiratory failure. Strategy, worst breathing signs equals first. Question 37. Who is priority? A. Client with hypoglycemia, Bg 40 mg per deciliter. B. Client with anemia hemoglobin 8. C. Client with diarrhea x 2 days. D. Client with hypertension BP 160/90. Answer, A. Hypoglycemia, Bg 40. Rationale, immediate risk of seizure/brain damage. Strategy, critical glucose less than 50 equals emergency. Question 38. Which client requires immediate care? A. Client with pneumonia, O2 sat 82% on 2-LNC. B. Client with fractured arm and cast. C. Client with UTI awaiting culture. D. Client with diabetes needing insulin. Answer, A. Pneumonia with O2 sat 82%. Rationale, severe hypoxemia. Strategy, airway/breathing all else. Question 39. The nurse has 4 clients. Who is seen first? A. Client with CHF reporting pink frothy sputum. B. Client with pneumonia temp 101 degrees Fahrenheit. C. Client with COPD waiting for meds. D. Client with arthritis requesting warm compress. Answer, A. CHF with pink frothy sputum. Rationale, pulmonary edema. Strategy, acute respiratory infection comfort. Question 40. Which client should the nurse see first? A. Client with appendicitis reporting pain. B. Client with kidney stones with hematuria. C. Client with anaphylaxis after antibiotic. D. Client with gastritis awaiting meds. Answer, C. Anaphylaxis. Rationale, airway obstruction risk. Strategy, look for allergic reaction signs. Question 41. Who should be assessed first? A. Client post-thyroidectomy with difficulty swallowing. B. Client with pneumonia with productive cough. C. Client with DVT complaining of calf pain. D. Client with cirrhosis reporting fatigue. Answer, A. Post-thyroidectomy difficulty swallowing. Rationale, possible airway compromise. Strategy, post-surgical airway chronic disease. Question 42. Which client is priority? A. Client with Bg 300 mg per deciliter. B. Client with Bg 48 mg per deciliter. C. Client with hemoglobin 9G/DL. D. Client with fracture pain. Answer, B. Bg 48 mg per deciliter. Rationale, hypoglycemia equals immediate brain risk. Strategy, low sugar high sugar. Question 43. Who should the nurse see first? A. Client with new onset chest pain. B. Client with COPD on 2LO2. C. Client with diarrhea. D. Client with migraine headache. Answer: A. New onset chest pain. Rationale: possible MI. Strategy: acute cardiac chronic stable. Question 44. Which client is priority? A. Client with suspected stroke, right-sided weakness. B. Client with nausea, vomiting. C. Client with diabetes requesting insulin teaching. D. Client with gout reporting foot pain. Answer: A. Stroke with right-sided weakness. Rationale: immediate neuroemergency. Strategy: sudden neurodeficits equals urgent. Question 45. Who requires immediate care? A. Client with asthma, O2 sat 76% on room air. B. Client with CHF reporting mild edema. C. Client with UTI requesting antibiotics. D. Client with post-op pain 8/10. Answer: A. Asthma with O2 sat 76%. Rationale: severe hypoxemia. Strategy: airway/breathing circulation comfort. Question 46. Which client should the nurse see first? A. Client with chest tube suddenly with no drainage. B. Client with pneumonia awaiting sputum culture. C. Client with diabetes awaiting morning insulin. D. Client with arthritis requesting heat therapy. Answer: A. Chest tube suddenly no drainage. Rationale: may indicate obstruction/tamponade. Strategy: unexpected post-op change equals urgent. Question 47. Who is the priority patient? A. Client with post-op pain 7/10. B. Client with new facial droop. C. Client with UTI dysuria. D. Client with mild dehydration. Answer: B. New facial droop. Rationale: possible stroke. Strategy: new neurochange pain. Question 48. Which client is priority? A. Client with COPD with O2 sat 80%. B. Client with hypertension BP 150/88. C. Client with diabetes BG 220 mg per deciliter. D. Client with fracture awaiting X-ray. Answer: A. COPD with O2 sat 80%. Rationale: hypoxemia equals immediate threat. Strategy: ABC's routine. Question 49. Who should the nurse see first? A. Client post-op with bright red bleeding from incision. B. Client with gastritis asking for antacid. C. Client with pneumonia with productive cough. D. Client with arthritis requesting meds. Answer: A. Post-op bright red bleeding. Rationale: indicates hemorrhage. Strategy: active bleeding pain. Question 50. Which client is priority? A. Client with anaphylaxis, difficulty breathing. B. Client with diabetes awaiting insulin teaching. C. Client with UTI awaiting culture. D. Client with chronic pain requesting medication. Answer: A. Anaphylaxis with difficulty breathing. Rationale: airway obstruction fatal if untreated. Strategy: airway emergencies always first.
And that is it for today's 50 priority Nclex questions on who do you see first. Remember, the secret to mastering these questions is sticking to the basics: ABCs, Maslow's hierarchy, unstable before stable, and life before comfort. If you can apply those every time, you'll know exactly where to focus your attention. If this video helped you, make sure to like, share, and subscribe for more Nclex prep. And if you're ready to take your practice even further, check out our video on Nclex lab values you must memorize. It's packed with must-know numbers that go hand in hand with today's priority questions. Keep practicing, stay confident, and remember, you've got what it takes to be an amazing nurse. Until next time, happy studying and good luck on your Nclex.